When you grab coffee with a friend, what do you normally talk about? Is it war, hurricanes, seizures, or maybe I'm just a bit weird? Last October, I was sitting in a coffee shop with my friend Levi, and we were brainstorming different problems that we see in the world, and all three of these topics came up. We had been discussing the use of drones in the Ukraine war and talking about how unfortunate it is that these amazing feats of technology are being used to harm people instead of help them. When thinking about how they can help people, one obvious use I saw came from the devastation we witnessed in the wake of Hurricane Helene. You see, I went to college in the mountains of North Carolina, not too far from where we saw clips of residents trapped on their roofs with no clue when they would be rescued. I thought of not only how scary this must have been, but also how dangerous it is when one of those residents is trapped on their roof in dire need of insulin. Levi's neighbors, Douglas and Marlis, are farmers in a rural town in central Minnesota. Douglas recently suffered a stroke, leaving him unable to use the right side of his body. Going to the kitchen, let alone the pharmacy, was an impossible task for him. This left Marlis responsible for caring for Douglas and the farm all by herself. And this included making frequent trips to the pharmacy to retrieve Douglas's medications, often leaving Douglas vulnerable and alone. These two situations led us to realize that there are some very serious and sometimes unique challenges in healthcare access. According to the UC Berkeley School of Public Health, over the past decade, nearly a third of pharmacies have closed nationwide, affecting rural communities the most. And what used to be a quick errand has in some cases become a 2-hour round trip. Elderly residents, a significant portion of rural communities, tend to need more medications more frequently and face higher transportation barriers. These transportation barriers include the inability to travel for a variety of reasons and the need to rely on others. That cost isn't just in gas. It's hours off work, it's a ride you can't find, it's a refill that you delay, and a dose that you miss. It's a slow drift from, I'm managing it, to, I'm falling behind. The inability to access prescriptions is experienced every day by millions of Americans throughout rural communities. A pharmacy desert is a town that is 10 or more miles from the nearest pharmacy. Each one of these dots represents a pharmacy desert. In fact, according to the National Community Pharmacists Association, nearly 45% of all US counties contain at least one pharmacy desert. And in those counties, 48 million Americans are currently facing these issues. Unfortunately, the number of pharmacy deserts continues to grow. One of these dots is a town called Boy River in north central Minnesota. With a population of only 26 people in the 2020 census, this town is so small that the city hall was up for sale when I had visited. I decided to stop in at the only business in town, a bar. And after buying a round for the 5 people at the bar, they agreed to entertain a few questions that I had about their access to prescriptions. And I know, not your typical bar conversation, but the residents I spoke with revealed they faced a more than 2-hour round trip by car just to retrieve their medications. This is in stark contrast with people who live in urban centers, who can have medication delivered to their doorsteps within hours or even minutes. And this caused me to wonder, why wasn't there already a good solution in place? So I began to talk to multiple rural pharmacies, both big names and independently owned. I learned that traditional long-distance deliveries are far from practical or cost-effective. I even spoke with an executive at a large regional grocery chain that has in-store pharmacies. He revealed that they had to stop their prescription delivery, as the costs were not sustainable even for them. Again and again, I heard from pharmacy owners all across the Midwest that providing prescription delivery was unsustainable for their business. The more we learned about the challenges of rural access to pharmacies, the more curious Levi and I became about possible solutions to this problem. We set off on what would become a journey that sent us all around the Midwest and had us on hundreds of virtual calls with rural healthcare providers from all around the country. Our mission to understand the shortcomings of rural healthcare access even led us to meeting a really cool bald guy. Some of you might recognize him from a show where entrepreneurs pitch ideas to a panel of potential investors. One of the more interesting learnings from this journey was the logistical challenge that long-term care facilities face in rural areas. Certain pharmacies are tasked with supplying these facilities, and one such pharmacy in Duluth, Minnesota, has 15 vehicles in their delivery fleet, each making multiple trips daily. The average delivery is around 50 miles each way, with their longest daily delivery being over 300 miles round trip. I'm sure we can all agree their gas bill must be through the roof. Well, in addition to substantial costs for gas, other expenses include employing the drivers and maintaining the vehicles. For them, a brand new vehicle lasts only 3 years on average. Everyone we spoke with agreed that rural communities deserve better access to medications. However, the current economics for methods of rural delivery just don't make sense. A hospital in a Minneapolis suburb revealed another important aspect of prescription delivery, of healthcare access, sorry. Emergency medical service crews, or EMS, will often carry small amounts of certain medications in their units. In rural areas, when those supplies are depleted, they struggle with resupply issues as a result of the distance between the crews and the time that it takes to receive their supplies from their providers. Some suggest ordering your medication online as a fix, and it can be, but these services often take days to arrive, making them risky for time-sensitive medications. We'll talk more about that in a bit, because the thing that I really want to point out is that most online orders go through large pharmacy chains, not local drugstores. This pulls revenue away from our small-town pharmacies, speeding up their decline and exacerbating the rural pharmacy crisis. Rural pharmacies aren't just the means to an end when it comes to getting your medication. It's the place people go to see if the weird rash on their neck justifies a trip to the doctor or not. Conditions and medications. One example is a heart attack, known in the healthcare world as a cardiac episode. There are various types of cardiac episodes, but in many cases, you need to begin taking medication immediately, or the odds of having a second episode increase dramatically. For people living in a pharmacy desert, like our friends in Boy River, the distance to the pharmacy costs them an additional $40 in gas. And to others facing issues like cardiac episodes, the inability to access medication may cost them their lives. Sadly, as in the case of many social challenges, the people who are the most disadvantaged are hit the hardest by this problem. Whether that's tribal communities, low-income households, or seniors aging in place, those with the least access to transportation and healthcare options are the ones left without. Now, back to our drone conversation. Levi and I knew that drones are being used to overcome transportation barriers, and we wondered, could they be the solution to the problem of rural access with pharmacies? Well, we decided to pursue that possibility. And that coffee shop conversation eventually led us down a path, one full of questions, mistakes, and unexpected insight. That became BuzzCare. BuzzCare uses drone technology to deliver vital prescription medications straight to rural communities. We ensure faster, more reliable access to essential healthcare, no matter the distance. Nearly 1 year ago, Levi and I were just two people who knew absolutely nothing about drones, healthcare, or pharmacies. And we're not done yet, but what we've built so far has helped to show that prescription delivery can be up to 70% cheaper and 5 times faster when we think differently about distance. This enables delivery to not only be attainable, but it flips delivery from something that was once losing pharmacies money into something that now drives them revenue. The idea for our business was born from a conversation by two guys over a cup of coffee. And sure, we were talking about problems in our community and in the world, but we didn't stop at just naming the problem. Instead, we became curious about it. Our story didn't start with drones, it started with curiosity. Because when we stay curious and we stay close to the people impacted by the problem, we begin to understand that sometimes bringing care closer is the medicine. Our world is not lacking challenges. Next time you're in a conversation about a problem, get curious. And think also about how you might find the solution that could improve your community and even the lives within it. Thank you.